And that's really the concept here. Advantage Health Plans is all your dollar, from the CEO all the way down to the brand new teller. It's all your money. There is no insurance layer in Advantage. But some of the metrics that we wanted to talk about, APP, that's just our acronym for Advantage Premier Provider. This is actually old. We had our biggest month for Premier Provider utilization in September. So we've been doing this for 21 months, and last month was the biggest. This was as of August 31st. We had done 237 procedures for Advanced Health Plans bankers through one of our Premier Provider arrangements. As of August 1st, not 31st, as August 1st, the savings just from Advantage Premier Provider utilization is $2.4 million. We really think that by the end of the year, that's going to be at $3 million. It's really stunning. I mean, it really is. We've never had any sort of a cost containment program that we've ever put in place in 40 years of operation that has yielded that type of result. And the thing that we talk about in employee meetings, and we hear it from bankers all the time, is that, you know, we're able to save the health plan a lot of dollars, but we're able to do it by simultaneously either eliminating or greatly reducing the employees out of pocket, which is, I mean, I've been doing this for 21 years personally, and I've never, anytime anybody talks about, hey, we're going to lower your health plan cost, that usually is being done by raising deductibles, increasing copays, or co-insurance. So really excited about those results.
And one of the things that I think is important to point out, that $2.4 million that's shown there as of August 1, that's what the trust has saved, because it paid, the cost that it paid for those procedures is so much lower than the cost that would have been charged had the participants gone through the individual means. That number does not include what individuals saved, because when they went through the Premier Provider process, they didn't pay any out-of-pocket, and they didn't do any co-payments, they didn't do a deductible. So those are amounts that the individual employees are saving out of their pocket that are not included in that number. And I think it's important that people realize that and kind of keep that in the back of their heads.
Right. That is a great point. And I think we actually did a Solutions from Services article in IBAT where we had talked a little bit about a particular bank that I think they had 6 or 7 Premier Provider utilizations done, saved the bank's health plan about $63,000, but because of the deductibles that this bank had, it saved the individual employees something like $40,000 in aggregate deductibles and out of pocket. So thank you, Murray, for reminding me of that. That's a big deal. Prescription utilization. You know, we've sent out a lot of information about buying better on prescriptions, whether it be generic utilization or just finding therapeutic alternatives to name brand drugs and buying better, taking advantage of some of the, for instance, we have the 100% out of over-the-counter benefit for prescriptions. A lot of our bankers either didn't remember that or just hadn't really understood how it worked. But through a lot of our education that you all have enabled us to do through flyers and email blasts and distributing that out, we've actually seen a net reduction in prescription costs over the last year. Again, last year I was telling you about how prescription utilization and costs was going up at, I think it was 11–12%. Now it's actually gone down for 2013, which again, it's done. It's a result of your action in being better consumers. One Call, which is our imaging, kind of our imaging program. Think of it as kind of like a PPO, and you all know I'm not big fans of PPOs, but One Call is better than, it's kind of a PPO on steroids, but when you need to have an MRI or a CAT scan or a PET scan done, you make that one call to them, and they will make an appointment with a more efficient, lower cost, high quality facility. We've had 229 scans that have been provided by One Call in the last year, with an average savings of $289,000. Again, a big deal.
Now, Jay, that's the same as Premier Provider, isn't it?
It absolutely is.
When they use the One Call, the employee doesn't have an out-of-pocket cost.
Yeah.
So the savings, again, shown there for the trust, don't include what the individuals who use those 229 procedures saved in their own out-of-pocket costs.
That's
as
right.
well.
We do structure one-call utilization like a premier provider, and I keep, I guess I assume that everybody knows that, but thank you continue to remind me that, yeah, when that utilization happens, the employee is not out anything, and as Maria always likes to remind, it is free to the employee, but it's absolutely not free. You know, bankers understand that nothing's free, but it does reduce or eliminate the employee's out of pocket. Lab card, we've had 1,187 lab procedures that have been done at lab card. Again, we have better pricing through a lab card facility. In some of our banks in Texas, we've actually been able to do some direct negotiations and some direct arrangements with some independent labs. You know, a lot of times we don't know about those labs that would be willing to negotiate until we hear about them through you. And so, again, lab card is a wonderful thing, but they are essentially a broker of discounts. I mean, they're selling access to better pricing. If we can just simply put the buyer, which is the health plan, and the seller, which is the lab, together and have a direct relationship, a lot of times we can get additional savings and reduce a complete layer of bureaucracy. Healthcare Blue Book, that's a initiative that we did in January. To date, we've had over 7,000 searches on Healthcare Blue Book, which is huge. And it, again, works very much like a Kelly Blue Book, and it's simply to highlight and communicate to the employees what providers, whether they be doctors, hospitals, labs, whatever, the ones that are lower cost and also shed some light on their quality as well. Premier providers are also, obviously, they're highlighted in Healthcare Blue Book as definitely almost like pricing benchmarks, and they are color coded for, you know, green providers, red providers, and yellow providers. Of course, we want people to use the green providers. That's why we've had our Go for Green initiative.
And you might mention, I actually was looking just for my own edification here on the Healthcare Blue Book side, and there is an app that is available for iPads and iPhones and Androids that is really easy to use.
Yes.
And you know, that letting people know that it's that easy, it's at their fingertips. It's not like they have to go out of their way to really go hunt for the information. Most everybody has access to it, either on the phone or on a mobile unit or an iPad or their computer. It's very easy to use.
And we've seen some utilization, and we'll talk a little bit more about Healthcare Blue Book, but the mobile app is really intended for when that employee or that patient is on their way to the doctor's appointment, and they say, you know, hey, I think I got a sinus infection. I wonder what a office visit should cost. And they can look it right up on Healthcare Blue Book sitting in the parking lot, and hopefully they'll have that discussion with their medical provider that, you know, hey, what are you going to charge for this? And you know, the doctor will first look at them like they're crazy. Why do you care? How do you know this? And of course, the employee can say, well, you know, hey, I have access to some of this pricing through Healthcare Blue Book. So, again, I said I'm not a big fan of PPO discounts. You know, more evidence of why. These are some every one of these are actual utilization. We had some examples of this last year. We've got more this year. You know, for instance, there you can see that bilateral knee replacement, actual participant, Texas participant on that one had bilateral knee joint replacement. The billed charges from their provider was just a hair under $200,000 were the billed charges. The network discount on that brought it down to, I think, $153,000. The premier provider, which in this case would have been either Pine Creek in Dallas or McBride Orthopedic Hospital here in Oklahoma City, their cash price for that bilateral knee joint is $30,000. When I say these things and I give these examples, you know, I can just almost see, especially if first time you've heard it, I can almost see the audience look that I'm telling them, I'm fibbing to them, because this just can't be right. But it is right. It's what we're experiencing.
And what it really represents when you do the numbers, I mean, if you're paying $150 and it could have cost you, what was it at McBride?
30.
30. You're looking at the trust paying $120,000 more for that one person, that one procedure that could have been saved in the trust had they chosen to use the premier provider.
Right.
That's real money going out of the trust.
And, you know, the dirty little secret, I actually had a PPO representative actually in this very room where we're doing the webinar earlier this week. And the dirty little secret out there that I think is going to get more and more attention is that there is actually a repricing scheme, if you will, out there that's very commonplace. I brought it up to her and she just acknowledged that, yeah, that's how we make a lot of our money. But how that works is, for instance, on that bilateral knee joint replacement, the billed charges were so high, and of course they were able to get a $50,000 discount. But the way that works is if they discounted that down to $150,000, they may have actually gotten a discount down to $140,000, but kept $10,000 of it, and the PPO company pockets that. I mean, that is I had a pretty spirited discussion with her that, you know, that is a very, very slippery slope, that when any entity in healthcare starts to, you know, stick their hands in the cookie jar of claims, then all of a sudden they're going to start making, they're incentivized to make some pretty egregious business decisions. When they're out there negotiating on a health plan's behalf, along with a hospital, there is an actual incentive for them to negotiate with the hospital to charge more so they can show a bigger discount, so they can take a bigger cut of that discount. I actually had I'll go to the next slide with some more examples. I was actually having a conversation with a banker in Texas at the IBAT convention. They're not with Advantage Health Plans, they're with Blue Cross. We've got an appointment with them though in a couple of weeks, so hopefully that'll work out. But they were commenting that they had had some surgery done, and the bill charges, I can't remember the exact numbers, but let's just say that the bill charges were $50,000. And after Blue Cross negotiated it, they were able to negotiate it down to like $14,000. And she just came up to me and she just looked at me. She goes, you know, I just don't buy this anymore. I just don't. These numbers, she goes, I just don't feel like the bill charges were obviously monopoly money. There was no rhyme nor reason to that. The discount that, you know, just because Blue Cross comes onto the scene and they can negotiate that down by a huge percentage, she goes, I just have a feeling that I don't know that I'm being told the truth by the bill charges or the discounted amount. She goes, I wonder what the cash price is. And I said, oh, you need to come to our booth because we need to talk. And so when she was arriving, I mean, bankers, you all are very smart numbers people, and you kind of get that. Again, you know, examples here of a hernia repair, carpal tunnel, arthroscopic knee surgery. The differences between the bill charges, the PPO pricing, and then the green is actually the premier provider price. It's absolutely stunning. You can really see how the health plan can waive deductibles, copays, and coinsurance. Premier providers, the concept of free market transparency in healthcare is growing. It's growing pretty rapidly. I think the last time we spoke with you all, I think we had maybe 6 premier providers. We're actually at 10. We've added a new one since the slide was created. All of them, unfortunately, right now are in Oklahoma, with the exception of Pine Creek, which is there in Dallas. But the good news is that we have a lot of coming soons, as you can see there on the slide. Several of them in Texas, Austin, Dallas, Frisco, New Braunfels, the Christus group down in, I believe, San Antonio. Those are all providers that we're negotiating with. Just to give you all a little bit of feedback, they've been on our coming soon list for a while. There is unfortunately, there is a idea or a concept that I like to call opaque transparency, that these providers, they kind of get the concept, but they're not really ready to be above board and compete openly. And so we're continuing to have to kind of chisel away. There is a will, so hopefully we'll find a way. But if anybody has a relationship with any of those facilities and has the name of a decision maker, I'd love to buy a plane ticket and fly down and talk to them a little bit about it. But it's a new concept for them, and a lot of times they'll actually tell us that, well, there's nobody else in our area that's doing this, so why would we want to compete openly and honestly for patients? And it's a supply and demand. It's a competition thing. If they don't perceive that they have competition, they can continue to kind of set their pricing the way they want.